Good afternoon. I'm Dr. Martha Buchanan, the Director and Health Officer here at Knox County Health Department. For our moment of gratitude today, we'd like to thank all the facility and environmental services teams across Knox County. These folks are working diligently to keep our offices, clinics, hospitals, and workplaces clean. Thank you for all that you do to protect public health. As we mentioned yesterday, we're continuing our drive-through testing today, Wednesday and Friday this week. Those interested in being tested are asked to call our public health information line, 865-215-5555, to get an arrival time. The public can also get information about other testing options at walk-in and urgent care clinics and some other private providers by calling this information line. Moving on to our local situation. We have 316 confirmed cases of COVID-19 in Knox County. Additionally, we have 4 probable cases. 264 of our cases have recovered. 47 individuals have been hospitalized at some point in their illness. We are pleased to report no individuals are currently hospitalized. And we're also, again, very grateful to report no additional deaths due to COVID-19 complications. I do want to take a moment to talk about the one thing we all have to get through this, incredibly difficult time, and that's compassion. The pandemic has affected all of us, none more so than the 5 families who've lost loved ones. But it has affected us, our jobs, our families, our lives. These are scary, uncertain times. But we must never forget who we are or what we stand for as a community. We hear stories of people being frustrated over the guidelines and recommendations. And we get it. We know they're hard. We all want to believe it's over. And we're all really ready to move on. But the fact remains that it's not over. The virus is not gone, and the risk is still very real. So if you're out and see someone with a mask and you don't agree with it, show compassion. If you're out and you see someone without a mask, show compassion. If you're asked by a business to follow certain guidelines, show compassion. The only way we'll get through this is together. And now I'll open it up for questions.
All right, if the media has any questions, if you'll please put it into the chat box, we'll get started. From the Compass, we have reports of major local restaurants directing their employees to disregard the health department's orders and of employees being fired for refusing. Do those reports give you any pause about the complete lack of enforcement of the phase 1 guidelines? And the second part of that is the lack of enforcement putting local service workers in danger?
So I think it's really unfortunate when an employer or an owner chooses to ignore public health guidelines. And it puts their employees and the public at risk. And as we've said many, many times, we rely on the good judgment and goodwill of employers, employees, and owners to follow these guidelines. And what I would say to the public is, if you want to send a message to those folks who are not following guidelines, vote with your pocketbook and choose not to patronize those locations. It does put people at risk when they don't follow the guidelines because coronavirus is still circulating in our community. And you can't tell by looking at someone whether they have the illness or not. And I think it's really unfortunate that they make those choices.
Okay, from WBIR, yesterday Governor Lee said the biggest challenge Tennessee is facing is ensuring people's health as they go back to work. Do you think Knox County is succeeding in this challenge?
I think if employers, owners, and employees will follow the guidelines that we put out, they will be succeeding in protecting the health of their employees and the people who they are serving.
Okay, from WVLT, it appears the Knox County and City of Knoxville mayors have differing notions on how and when particular types of businesses should reopen. If they are unable to agree, how will that affect the health department's ability to create and implement a plan?
These are challenging times, and people have different beliefs and different ideas about how things should be approached. My job as the health officer and director of the health department is to recommend a plan moving forward and how to do that safely and protect the public's health. And fortunately, both mayors have been able to agree to recommend the community follow those guidelines, even when they're not always exactly what they would do if they were in my shoes. To me, sometimes that tells me we're hitting a nice middle ground with the advice from the task force and the advice that I'm giving. We're not making everybody happy. So maybe we're striking the right note.
WUOT, Knox County Schools will likely see hundreds of attendees at its graduation ceremonies in June, marking the largest gatherings in the county in weeks. Do you see graduation ceremonies as exempt from the phased reopening plan?
They're not exempt. I believe the plan that the schools have written does take into consideration the general guidelines for reopening, and they'll be following those, I'm sure.
WATE, yesterday you mentioned meeting with staff to do a deeper dive into the data about the downward trend in active cases. Did that meeting happen? What did it reveal?
I've spoke with my staff, and we continue to see that our cases are trending about the same as they have been, a little lower actually. So our 14-day trend continues to be lower. So we're encouraged by that. There's some other things I haven't looked into. We'll take some time to do over the next couple of days.
Okay, from WBIR, do you have results back from the mass weekend testing at the 6 KCDC sites? And there's a second part to that.
Okay.
If so, can you say how many tests were given, how many positives you found, and what proportion were asymptomatic?
So there were over 400 tests given. It was somewhere around 480, something like that. I may be a little off on that number, but somewhere over 400. And at this time, we have most of those results back. And I'll have to get back to you on the exact number of positives. I do know that it was low. And we're also, in some of these mass events, we're not collecting symptom information. The National Guard did actually do the testing in these events, and we don't have the information about whether people are symptomatic or asymptomatic. And part of that is just to make it go faster. Asking people about symptoms takes longer. What we do is we follow up with the positives, and we ask those folks if they're symptomatic or not. And what we're finding is 15% of our cases are asymptomatic. So there are some folks who are positive and asymptomatic.
Okay, this is the second part to WBR's question. Antibody testing is becoming more available in Knox County. Should people be getting this test if they believe they had COVID-19 or before heading back to work?
So antibody tests have their limitations, and currently they're only recommended for either research or community-based screening or surveillance, not really screening, surveillance. They're not at this time recommended to use to determine if you have immunity, whether you have or have had disease, or whether you haven't had disease. They're just not quite there to be used to determine if you've had the illness or not. So we don't recommend that they use those in trying to determine that.
Okay. From WATE, can you share with us the latest number of complaints about businesses and contacts with those businesses by your department?
Unfortunately, I don't have those numbers today. I know sometimes I have them, but today I didn't get them. But we can get back with you on that through the JIC.
Okay, and from WBIR, as surrounding counties prepare to loosen restrictions per the state plan, do you think Knox County is ready to do the same?
Well, we'll be coming out with our recommendations later this week. We're looking at that, and we're considering that. We're looking at our data. Our data looks really good right now. So I think we'll be able to recommend moving forward into phase 2 as planned, possibly next week.
Okay. So, and this is the second part to that question. Where are we on the curve, and are we still rising sharply, not so sharp, flat?
Well, we've never been rising sharply, to be honest. At the very beginning, it looked kind of sharp because we were going from, 1 case to 3 cases, and that's, quite a bit of an increase. We've been very flat for quite some time. Really just our new cases, only our case growth rate is very low, in the 1 to 2% range. So we're very pleased with that. We hope we can stay there.
Okay. From WVLT, is there any policy that could offer protection to employees who may be asked to break COVID-19 safety recommendations at work and are subsequently terminated due to failure to do so?
I'm not familiar with employment law, so I don't really know the answer to that question.
From WATE, if home and neighborhood pools reopen, will chlorinated water or salt water kill the virus or prevent it from being spread?
So here's the challenge with pools. COVID-19 is a respiratory illness. It's not spread through the water. There are things that are spread through the water, chlorinated or not. So it doesn't spread through the water, but think about what we do at pools. We don't just swim. We gather, we socialize, we eat, we touch, we horseplay in the pool. We do all of those things that we do in a pool, and try to keep some kids away from each other in the pool when they're trying to play a game of whatever it is they're trying to play. And you're going to find that really hard to do. So the challenge with pools is really what happens on the pool deck and the horseplay or playing that happens in the pool. It's not swimming.
Okay, if the media has any other questions, if they'll please submit them into the chat box. Okay, we got another one from WATE. Have you met with Mayor Jacobs in the last day or so about the reopening plan?
I've been in conversation with Chief Hare about the reopening plan, who is subsequently communicating with the mayor. So yes, I've met with the mayor's office.
If the media has any other questions, if they'll go ahead and submit them into the chat box. This again is from WATE. Are there any deaths that are probable but not confirmed?
No, we have had no probable cases pass away.
Okay, we got another one from WBIR. Can the health department use its kitchen inspection powers to more strictly enforce things such as mask use and social distancing in eating establishments?
We actually asked that question of the state of Tennessee. Our kitchen enforcement powers were given to us by the state of Tennessee. That's a contractual arrangement with the state. And no, they are not considered part of the food code. It cannot be considered a food code violation. Again, I go back to, we really rely on business owners and restaurateurs to do the right thing by their staff and by the public. And for the most part, they're doing that. People are really being great and cooperating. And when offered course correction by my staff, they're taking it and implementing it.
We have a couple more minutes. If there's any other questions, please go ahead and enter them into the chat box. Okay, well, there appears to be no more questions for today. We hope you have a good afternoon. And oh, wait, we got a couple more. Excuse me, we just got one more from the News Sentinel. Any possibility the county will move forward with phase 2 before May 28th?
We'll be meeting with the task force later today and coming out with recommendations later this week.
Okay, any other questions? Oh, WUOT, excuse me. Have there been any cases of COVID-19 at the Knox County Jail to date? And has everyone currently being held in the jail been tested?
So the sheriff's office is doing a really great job of, they've implemented a plan internally of how they manage folks who come into the detention facility and using quarantine appropriately. We've talked with them about that. We have not had a positive case in the jail at this time. They are testing those who need to be tested, so everyone has not been tested. Instead, they're using quarantine appropriately to watch folks when they come in to see if they develop symptoms and test if indicated.
Okay, from WATE, Is there any way to offer buffet service at restaurants and follow the guidelines, i.e. are sneeze guards enough?
Unfortunately, sneeze guards are not enough. I think there's some places who have come up with ways to do that. But the bigger sneezing is one thing, but the other thing is that we touch those implements and get the food, put it on our plate and put it back down. So that's that high touch spoon or whatever tongs that you're getting your food out with is really where you're going to have that contamination. So some folks have come up with creative ways. I know that they're maybe using their staff to serve off the buffet line and other things. So there are ways around it, but it's that high touch utensil that really is the risky piece of a food bar.
All right, any more questions, please submit them in. Okay, well, that appears to be all. Well, thank you again very much for your time. We hope you have a good afternoon, and we will talk to you tomorrow.